One-on-One with Dr. Mehmet Oz, surgeon and best-selling author. His syndicated show, by the way, now in its 12th year. They said it couldn't be done. He is talking COVID-19 and bias in healthcare and racial injustice and a lot more. He's a cardiothoracic surgeon. He joins us from New Jersey. Always good to have you, Dr. Oz. What's your reaction to the Bob Woodward interview of Donald Trump when Trump said he wanted to play down the virus?
It's concerning. It was difficult enough without politics getting involved to figure out how to manage this virus. I just had several members of the White House task force on my program, this testing czar Girard and Surgeon General Adams, and they were very open about the fact that there was so much confusion early on with the pandemic that those are issues that we as a nation are going to have to grapple with, not just for looking backwards at what happened in COVID-19, but for future viruses. We have an underfunded, weakened healthcare system, healthcare monitoring system, public health system that we're going to have to address. Then you add politics to that, and you know what they say: you mix politics with medicine. You know what you get? Politics. Medicine sort of gets left out, and that's unfortunately happened more than we want.
How did it come to that in the most advanced country in the world?
Public health is like watching paint dry for a lot of people. Not much is happening. If you don't hear from them, you don't notice they're doing anything. But in fairness, that's what success looks like. You never hear from them. They get ahead of a problem, they deal with it, and it goes away. Take the flu. They monitor the flu. We have all kinds of tools to do that. But you've got a major advantage. With the flu, people tell you they're sick. And then you can say, okay, we have 10 people here who are sick, 25 people there that are sick. We got to be careful in this area. With this virus, 40% of the spread is probably asymptomatic. Now, maybe asymptomatic people don't spread it quite as much as someone who's coughing and hacking and sneezing, but it makes it really hard for a public health service to figure out who's sick if you can't tell and they can't tell. So those are the kinds of problems that led to the importance of testing. And you'll all remember this, and Admiral Girard knows this firsthand because he was hired on March 12th. Now, March 12th was 2 months after the first reports that we were aware of from China of COVID-19. We still did not have testing in America that was reasonable. And so he was hired to become the testing czar to at least build us in some capacity. Now we can do hundreds of thousands a day. But, it took a while. And that's awkward because no modeling that this country ever ran to predict our competence to deal with the pandemic ever assumed we wouldn't know that there was a virus out there. We always, assumed we'd be able to know somebody was sick.
All right. Well, what do you make of Trump's handling of telling Bob Woodward that he knew it was deadly stuff, but he didn't want to, he played it down to America?
Well, it creates a credibility gap, and it's a challenge. I can't discuss the politics of this any more than anyone else can, because you all saw the reports, and I pushed the testing czar, Admiral Girard, on this issue, and he said, listen, we'll have plenty of time to look back and try to figure out what we could have done better. But one thing we cannot afford to do is make the same mistakes going forward. And so we expect there to be more virus as the weather gets cold. The virus does better in the cold weather. Plus, we as human beings are more indoors in poorly ventilated rooms sometimes where super spreader moments can happen. So let's just figure out how to get through the next few months till we get a vaccine, because that's going to be our number one challenge. And I think a lot of Americans still do not respect this virus and what it could do to you.
All right. Trump continues to suggest we'll have a vaccine maybe before Election Day. Most experts are skeptical. Where do you stand?
Well, I'm skeptical as well. I haven't had a big name experts believe we would have a vaccine available, but I have had people now come on and say, we believe we will know if a vaccine will work by Election Day. And I theoretically, between when we know that it works and we can start broadly administering it, that's a month or 2 or 3, depends. And so at least by the end of this year, beginning of next year, we would start vaccinating the high risk medical responders, the first responders, as well as people in nursing homes and otherwise vulnerable. But, Larry, just this week, the Chinese finally announced that they have already given hundreds of thousands of their own vaccine to their doctors and first responders. So it's already starting in other countries, if not ours. And again, that vaccine's not proven yet in China, but I'm assuming they have enough data to feel comfortable starting to use it if they're already giving it to their own people.
Dr. Barry Bloom, an expert in infectious disease at Harvard, says the idea of vaccine will end the pandemic isn't realistic.
Well, I think the data we have on antibody longevity makes you concerned about the durability of a vaccine, but at least for a few months, people are protected. And I'm not as concerned about younger people. I'm especially concerned about people who are in the high risk categories, the vulnerable population that really pays the price when they get sick. And if we can figure out ways of immunizing them, even if it's done more than once a year, it would still be a major step up from where we are right now, where much of the population has never seen anything like this vaccine. I also don't want to underplay the importance of immunologic response that we have from pre-existing coronaviruses. The Germans and the Swedes believe that up to a third of their population may already have immunologic protection against COVID-19 because of past common cold viruses that the population may have been exposed to. And that would dramatically increase the number of people who are protected, thus getting us closer to herd immunity. Now, we don't want to try to get the herd immunity by getting infected. That's not a wise path. But if you add a vaccine to people who have other protection for prior exposure to the common colds, you could protect the population better than we have to date.
We keep hearing the term emergency use authorization. How does that work?
Emergency use authorization is a shortcut that the federal government, the FDA in particular, gives when we don't know for sure if with the traditional path that we always insist on, whether a medication will work or not. We can say, okay, it's an emergency. You're allowed to use it for now. We're going to keep studying it. Eventually, we're going to figure out for sure that it works or doesn't work. That could take months, even longer. But in the meantime, you have permission. And it gives doctors the freedom to do whatever they can. Because when you march to war, Larry, you march with the army you have. So even if you don't know for sure that every tool is perfect, at least have some tools you can use, then you can trust doctors and their clinical acumen to make the best judgment for their patient.
COVID-19 is a new virus. What are we learning about the potential long-term effects of it? What potential chronic effects of coronavirus concerns you the most?
I'm most concerned about brain fog and the emotional impact the virus has on us, both directly from infecting us and causing inflammation in our brain and causing blood vessels to clot off that may actually cause damage to not just the brain, but other organs, but also the impact of this infection on isolating people, especially older folks who are very dependent on interaction with younger members of their family to stay engaged, is problematic. It's also an issue for younger kids who need to be socialized, especially in grade school, and we're not able to do that normally. So you end up with both direct and indirect impact on our outlook. Listen, Larry, we are designed to realize that we're like little raindrops falling into the ocean of humanity. And when we forget that or are not reminded of that because of events like the COVID-19 pandemic, it has deleterious impact that's harder to measure than you might imagine, but it does manifest itself as anxiety levels, which are sky high now compared to the norm, and to depression, which has also increased dramatically.
We have a huge spike in the use of telemedicine during this pandemic. Any worries about that?
Telemedicine should have already been increasing. It was held back because of pure self-interest, because of state regulations, which often were just archaic and had fallen behind the times. And so I think it's a good thing that telemedicine has been free to grow. I mean, if someone has free time on their hands in Manhattan and a worker in South Dakota needs support, why wouldn't you connect the two people and let them help each other and provide a financial model for that to happen reproducibly? So I think it's a good thing that the states, most of them, dropped their barriers and allowed telemedicine to prosper. I don't think we're going to go back to the world where these are all limited because people realize that telemedicine is impactful. And companies now have grown rapidly to benefit from the opportunity to offer telemedicine. But you focus on things like our armed forces, where a lot of our vets can't get the care they want because they live in rural areas where it's not easy to get care. And they're far away from a psychiatrist that could manage their post-traumatic stress disorder, and that can lead to suicide because you're not getting adequate treatment. We have the tools with technology to get there. Why not use it? It's like saying we're not going to use Zoom anymore because it's too far. We want people back in the office. Maybe you do, maybe you don't, but it should be the choice of the people involved in the conversation.
It seems like every year the flu shot is earlier and earlier. I got mine in early August. When first should everybody get a flu shot?
Everybody should get a flu shot, and I get it every year, as I hope you do. And as a doctor, I don't have a choice in New York State because they really want you protected so you don't spread viruses from patient to patient. But I got to say, if most years you're sitting at home thinking, I'm not going to bother, it's not that big a deal, and more than half of Americans do not get the flu shot, so that's a common statement. This year, you shouldn't say that, because this year you not only benefit yourself from avoiding or reducing the chance of getting the flu, because the flu vaccine is not 100%, but it helps. But more importantly, for many cases, you won't be confused when you have symptoms of whether you have the flu or COVID-19. So instead of 2 weeks of quarantine and being put into an isolation room in a hospital, if you take the vaccine for the flu and you can avoid getting that illness, you can can leapfrog the entire process.
Anyone who shouldn't get a flu shot?
There are rare cases, and the doctors ought to be discussing it with them directly. And probably if you shouldn't get the flu shot, someone's already told you that.
If you have COVID-19, should you still get it?
Absolutely get the flu shot. I wouldn't get it right in the middle of COVID-19 and get past the acute episode, but you should get the vaccine before you get it or right after you've recovered.
All right, Australia and other countries in the Southern Hemisphere just finished their easiest, less serious flu season on record. Is that a cause for public health optimism in the United States?
I think those countries had easy flu seasons because they took advantage of the lessons learned from COVID-19. Stay away from people, wear masks. I mean, they did things that naturally reduced the spread of the flu. And we could benefit from learning what the Asians have already learned, which is during times of virus spread, act a little differently. In America, if you wore a mask in a subway, people would laugh at you last year. This year, if you're not wearing a mask in a subway, there's something wrong with you. So, it's dramatically shifted our expectations, and our vulnerability now is more apparent to most folks. So I think we're going to have a lighter flu season than usual because of the precautions we're taking for COVID-19.
When I asked you what's the biggest advanced medicine we've made in the last 5 years, and you said immunotherapy. Why does that work?
Immunotherapy works because the most powerful tool our body has and the most resilient tool we have is to respond to invaders from outside of us. Immunotherapy harvests that natural power and allows us to target more precisely cancer cells, coronaviruses, and ultimately a lot of other problems that we don't have solutions for right now. And I think it's an elegant switch from what we have historically done in medicine, which is to cut things out, to whack things, to burn things. And instead you take the subtle power of our immune system and weaponize it to protect us. It's a wise way to go.